welcome back to EMS1 News. Ed Bauter and Dan Schwester from the Overrun, and today we have a story out of Ann Arbor, Michigan. The University of Michigan and Brown University, my school, went ahead and did a study of 600,000 patients of color. And specifically, we found that 20% of the stroke notification, or Black people received 20% less stroke notifications going to the hospital. Danny, we've talked about medical racism before, and this study was pretty well controlled. Again, 600,000 patients were enrolled in this study, and they found that essentially the biggest difference was race for these patients.
Well, that's concerning. I hate
That's kind of the sentiment for all of these stories. They're just like, okay.
Yeah, I know. I mean, the data's there. It seems like a well put together study. I think we have to look at root causes, like why. And it seems that in this study, it wasn't a matter of, Black people don't call ambulances or Black people present to the ER by personal vehicle. They called the same, they were treated the same, they were handled the same. Why did they not get notified? When you think about the Black population, there is a lot of cardiovascular disease. There's a lot of stroke. There's a lot of, diabetes, all risk factors. And, we stress this in community health initiatives, and we try to get out to the communities, especially the Black community. Hey, you have to do this. You have to watch your blood pressure. You have to do that. You have to take care of yourself. And then we find out that they're not getting stroke alerted, to the same extent as other patients. I'm really concerned. This is I hope that there was some kind of root cause in there that's, that maybe it was just a communications issue or something like that. But again, we go back to this. Is it race? Is it just a different look at this? And, it's not encouraging.
And again, this study is coming out of the University of Michigan, which is certainly no stranger to studying different races. Regina Royan, who is one of the authors, said, quote, "We found Black patients who are having a stroke are being underserved in several ways during the chain of survival, a process that requires everyone from bystanders to first responders and clinicians to collaborate and move quickly to save lives. There is a disparity that must be addressed, as Black Americans have a higher prevalence of stroke, get strokes younger, and die at greater numbers from the condition." And just so we're clear about the actual time, the research found that Black patients experiencing stroke symptoms took about 28 minutes longer to be brought in for emergency care. And when we talk about the chain of survival, obviously we talk about, time is muscle. We talk about that with heart attacks, talk about with strokes. And now we're seeing that this population is disproportionately being notified, or hospitals are being notified much less more frequently. We've talked previously about not taking patients seriously, about having implicit bias in your actual assessment. But it seems now that there's at least some published data from reputable sources. The University of Michigan and Brown University are very august institutions, especially with medical research. So we're finding this now that it seems, at least in this study, and this was published on EMS1 on September 11th, it seems that the big variable here is just the race of the patient. They did a very good job trying to control for different variables, given that these Black patients were seen 28 minutes later or were notified 28 minutes later. And it's hard to believe that that's a function of clinical signs, as signs for strokes tends to be similar between patients. But it just kind of seems to be the situation where patients are being underassessed, undertreated, and it seems to be just a function of race, which is very distressing.
Yeah, it's extremely disturbing. And 28 minutes is a long time for stroke awareness, stroke recognition. When you talk about windows of 3.5 to 4.5 hours, even in the scope of, mechanical thrombectomy, which goes out to 12 hours, that is significant, and that affects recovery. It affects the ability of them to respond to therapy. It reduces the amount of salvageable, penumbra of brain tissue. We can't do this. We have to get better at this. This is, we've got to put aside these. If you have a bias like this and you're discounting stroke symptoms in people, there's a real problem here. And if you can't fix it, this is not the profession for you.
And this is something that we are going to go ahead and keep following. We reported on medical racism before, but be sure to check out all the rest of the Overruns material on YouTube. Check out the rest of our stories on EMS1.com. And for the Overrun, I'm Ed Bauter. He's Dan Schwester, and we'll talk to you all next time.